Welcome to the Hit Like a Girl podcast. This is High Tea with Grace, where we spill the tea on HIT. I'm thrilled to welcome Dr. Sherry McAllister. She's a doctor of chiropractic, president of F4CP, the Foundation for Chiropractic Progress. Thanks for joining us today, Dr. McAllister.
Oh, my pleasure.
So tell me about your career path that led you to your current position at F4CP. I know you guys have 30,000 members or more, so tell us about it.
Well, I actually got into chiropractic kind of happenstance, and it was a car accident that led me here to this very spot.
Wow.
And I was 19 years old, and I was injured in the accident. And unfortunately for me, the more I tried to get it fixed, the worse it got. And I visited a number of healthcare physicians, and it just kept getting worse. So I remember I was in cellular molecular microbiology. So my primary purpose at that time was to be looking in a microscope. And if anyone's ever had severe whiplash, and looking into a microscope it was awful. And I kept searching for a solution because I really wanted to be well. I was a very athletic individual. I wanted the spice of life. And it was very difficult to take the pain medications that I thought at the time were going to make me feel better. I thought that the pain medication was helping to cure the problem. However, I ended up with stomach problems and all sorts of unfortunate adverse events that came with the pain medications. But the worst part was I had headaches all day long, and they never went away. And there was one day I remember just thinking, should I even drop out of school? Can I actually keep doing what I'm doing? Because I'm so desperate for a solution. And it was as clear as day, even today. And just having that moment where one of my friends in the lab came up and said, why don't you try chiropractic? And I just looked at him and thought, what a bizarre thing to say. I said, well, if it would help, wouldn't they have already given me that option? And he smiled and he said, probably not. And that was the beginning to the rest of my life. Is I actually went to the chiropractor because I was so desperate, and just sitting in the waiting room and with tears in my eyes thinking, this is the last hope. And this is not even something I even understand what chiropractors do. And I walked out of there headache free.
Wow. I mean, talk about purpose exploding from pain. I mean, thank you so much for sharing your journey with us. What an incredible path. Now, what is F4CP now? And how did you get there? And what's your role at the company?
Okay, so becoming a chiropractor was the first step. And I was fortunate enough to open my own practice in Silicon Valley. And most that are familiar with that region of the world knows that it's super fast paced, and everything you do has to be really explicit for a purpose and an objective. And I was treating some Fortune 500 CEOs and executives so that I had all of my protocols and procedures down, that if they landed their Learjet and they got to my office in 9 minutes, because I was essentially 8 minutes from the airport, they could be in and out of my office in less than 20 minutes and back on their airplane. So I was in super tense mode to be the best chiropractor I could be. And for 25 years, I created a practice that would allow people to come from all walks of life. It was an open door. Come in, let's take care of the cause of your problem, not the symptoms, because that was one of the big pieces. And as I started to recognize that it was the larger majority of very influential and affluent that were coming to see me, I started to recognize there's a gap here, and that why are the blue collar workers, and where are the agricultural workers? Because in the area there's lots of them. Why are they not coming to see me? And I started to see the gap of education and what it meant to them and what the barriers were to care. And I was asked to volunteer for a conference in Las Vegas that the Foundation for Chiropractic Progress was at, and I had no idea what they did. And it was really just showcasing the education. And after that, I fell in love with it. And one thing led to another. And I recognized that my passion and my purpose were coming together to serve the people that may or may not be in a position where they know that chiropractic can be a solution for them.
How inspiring. I mean, you're a doctor, an entrepreneur, a community leader. I'd love to kind of dive into talking a little bit about trends going on in the space that you're in. So many people, why do you think DCs are the last doctor to be consulted for back pain, even though they specialize in managing, neuromuscular skeletal conditions? Why are they the last person to be talked to?
And that's exactly the purpose for me doing this job is it is an educational value statement to get the options out there. And so many think that there's only a pill for the ill. And unfortunately, that leads to a greater impetus of reliance for that pill or medication. It's kind of what I want to blow up is this is not the best kept secret. It has to be a secret that is open to everyone, so it no longer becomes a secret, and that we use chiropractic as a health care course of wellness and not just pain, because prevention, like we have professional athletes that would not go on the field until their chiropractor was there to evaluate them. Not that they needed an adjustment, which is what chiropractors call the course of care when we adjust the joints of the body. But the professional athletes have them, celebrities have them, and it's very unfortunate that it doesn't trickle down. But I'll tell you why this was such a problem is, unfortunately, just after World War II, there was a concerted campaign from the American Medical Association, and there is a book out by Dr. Howard Walensky and a doctor, Lou Sportelli, that played a big role in getting this information out. But the AMA had a concerted effort to drive people to medical doctors. And at that time, chiropractic was really picking up, and patients were seeing chiropractors almost 2-to-1 for the medical. And so there was a campaign that was called Contain and Eliminate the chiropractic profession. And at the end of the day, the AMA had to pay a lawsuit and apologize for the campaign. But the problem is the campaign did some unfortunate damage to the profession as a whole, and people still stick with this quackery. That's what they called us, and that was one of the things that really created a problem for us, was that it stuck, and it led to people not trusting chiropractic or thinking that it was like witch doctors. And at the end of the day, we're now pulling out of it, and we're now starting to showcase the wonderful research that's coming out. And we had people on that campaign like Elizabeth Taylor, Ann Landers.
Wow.
That, the AMA was paying to slander chiropractic.
Oh my goodness, what a nightmare. So, I mean, you're absolutely legit. So what kind of guidelines do DCs follow for the treatment of back pain that showcase the fact that they are doing real medicine here?
Sure. So for back pain, it is the American College of Physicians, which really is interesting because it's the medical doctors that write the guidelines. And we follow the recommended guidelines that really showcase that non-invasive approaches such as spinal manipulation, which we call an adjustment in chiropractic, should be the first line approach, and that looking at more invasive treatments should be second or third line approaches. And so the profession as a whole is amazing in following those guidelines. And that's one of the things that we have going forward in many areas where the patient can really benefit from, because they know they're going to get the least invasive option first.
I read an article from you recently called "What Recent Claims Studies Reveal About Chiropractic Care." And I just love the connection that you made between chiropractic care and value-based care. I'd love for you to just tell our listeners a little bit about what claim studies revealed from those studies about chiropractic care.
Well, I'll give you the headline so that it's an easy, understandable piece. But one of the most important factors is when you took the claim data and you analyzed it, what unfortunately it showed in the positive and the negative is the positive was patients were able to access chiropractic. There were fewer services that were used, but the doctors of chiropractic are often the last chosen provider. And again, that comes back to awareness. What options are there? How do I get to the chiropractor? Is it going to be covered? So there's a lot in there, but what the 4 studies really showed was that the first provider that was actually seen by an individual, and we're just going to talk about low back pain because that low back pain and neck pain is really what the 4 studies really focused on, are more likely to deliver guideline concordant care, which we just talked about, following those ACP guidelines. And the most important part, which we need to scream from the rooftops, that we were associated with the lowest total episode cost of any type of healthcare provider. And I'm just going to say that again, because it's so absolutely incredible. When you take millions of data points and you look over the course of them, we were the lowest episode cost of any type of healthcare. So one of the most recent studies had shown that when a doctor of chiropractic became involved in an episode of low back pain, they were the type of healthcare provider most likely to resolve the pain.
Wow.
Now, as I said before, unfortunately, we were the last ones to see the patient. So if you think about just my purpose on how I even got here, it was the last person. I mean, I had stomach ulcers from the medications, headaches every day, difficulty sleeping, and severe depression. And the last option, which I thought was like quackery, because no one gave me that option. So I thought, well, if it was even an option, why wasn't it given? And that's where the world has to change. We have to give the truth, the honest options to the patient to be able to make these facilitated and important choices.
Who did you work on this study with?
David Elton is a VP of musculoskeletal R&D at Optum Labs. And for many that don't know Optum Lab, you may know because it's actually a subsidiary of United Health Group. So he came together to put these 4 very unique papers together, and his team utilized like a massive claim database that was really to essentially investigate what are the links between the type of healthcare provider you initially contact, the services that you get. Because remember, this could range from walking in, being given an opiate, to perhaps surgery is an option. And then what happens? How often do you have to get to see that physician in total episode for that back pain or neck pain? And at last, which we need to be very, very honest about, because the United States spends more per person than virtually anyone in the world. If you think about combining low back pain with neck pain, we're spending almost $134 billion a year. And that's shocking.
Wow.
And, it's the second reason why people go to their primary care physician. And I think we need to get an honest look and be really careful in how we're going to be spending these dollars.
I was going to just say, what are the implications of these important studies, like for employers, for health insurers, for policy leaders? Where does this lead now that this information is out there?
And that's the reason why the foundation did a wonderful educational forum for health benefit consultants. Is when you bring out the clinical value and the financial outcomes, you have employers that need to make decisions, healthcare insurers, healthcare policy leaders, and it has to be a systematic change because let's be honest, we're suffering in inflation, and some will even push as far as saying we're going to be heading into a recession. So your dollars are stretched farther and farther. And if you don't believe me, fill up your gas tank. So we have to be able to look at the guidelines, who's following them, and what is the highest value of care that you can get when you're suffering with something that like low back pain and neck pain. So look at it in increasing the frequency of initial contact with a DC could make a massive difference in the cost spending and the value proposition to the patient. But more importantly, think about the people that, like me, I was suffering with stomach problems because of the prescriptions that were provided to me. And if I had had a non-pharm option, and we actually looked at this and say, you know, our out-of-pocket spending has to be appropriate, and we need to give incentives to see a least invasive option. That would change what I think would be the future of chiropractic and the future of healthcare, is offer the non-pharm option first. And it has the benefit of reducing cost, increasing satisfaction, and ensuring that the patient doesn't suffer adverse events to taking an opiate or some other painkiller that could be causing a problem.
And making sure it's available and accessible to all. I mean, from young to the oldest of old, and no matter where you are. I'm wondering, what do you see as the future of innovation in chiropractic care? You know, we have a big audience of health IT folks, healthcare innovation folks. You know, what kind of cool innovations are happening in the space that excite you?
I will tell you the one thing that I am continually in awe of is the brain. And the reason why is we haven't fully understood it. The heart is one piece, and we're starting to see some amazing new things about the heart that we never saw before. And if we recognize, especially for spinal manipulation, how does the nervous system and the brain connect? And can we have a role in how the brain is processing information? And that's especially when it comes to chronic pain. And the brain has a very special ability to be very, very flexible. And the question is, honestly, are we using that flexibility? It's called neuroplasticity. And over the course of the last 10 years, there's been a lot more studies in the brain and the brain function and reprogramming. So like people that have had strokes, how do we reprogram them for success? And what impact does the brain have on the tone of muscle, especially if you have had a stroke and you can't move your hand as much? But also think about dementia. This is starting to be an immensely important conversation, because we're seeing a great deal more people with Alzheimer's and Parkinson's. We need to study the brain, how chiropractic works with the neuromusculoskeletal system, and then innovate the system so it works at its peak. Because there's a reason why chiropractic is on hieroglyphics in pyramids. It's simplicity.
Mm-hmm.
When something is simple, it can be used so well. And that's kind of the beauty of it.
Truly. Now, I would love to now move on to your personal life. You are a very busy and successful executive. What are things that you do in your personal life to help work your best and make a difference?
First, the one thing that I think back on over the course of time is sleep. And that my past life, I tried to do it all, and the balance was really not as effective as I was hoping, because then I started to feel other things fall off my plate. But I would let sleep be the least important thing. And I remember training for a half Ironman and getting up at 4 a.m. And then I had 2 babies to take care of. So it was ongoing. And so if I got 4 or 5 hours, I was excited. Like, wow, look at that. We got 4 or 5 hours. However, what I started to notice as I started getting up in age is I started to recognize that my brain had fog, and I don't like a foggy brain. So I kept thinking and hearing, like Arianna Huffington came out with a book on sleep, and I thought, well, I'll give it a read. And then I started to recognize for my success to be truly motivated, passionate, and invigorated every single day, if I don't get 7 hours sleep, I suffer with brain fog. So that was the first piece I had to deal with. And it wasn't easy to put into play. It took me a good 5 to 6 months just be able to sleep more than 5 hours and then not wake up at that 5 hour. Like I would easily wake up at 3:30 in the morning and go, oh, it's time to go. I'm like, nope, I'm forcing myself back to just rest and relax. Even if I just force myself to do a prayer in bed, I'll call it meditation, so that I could fall asleep just for another hour. And it takes time, but I will tell your audience that if you're not getting good sleep, you're putting yourself at risk in many different areas. And we're starting to see the research come out, not only on brain fog, but on mental health. You know, how excited or positive are you in your world today? And it does come down to a healthy brain is a happy heart. A happy heart is one that is able to feel well balanced.
That is so interesting. Now you have to tell us, did you do the half Ironman?
I did.
Oh, so you can hit like a girl for real.
Yeah, it worked out. I did it in Calgary, Alberta. But up to that point, I didn't know how to swim. So the story goes that I had a sister from the church who reprimanded me because I had 2 small children and I didn't know how to swim. And she said, you need to learn how, because you have no excuse and you have 2 children. So I grabbed one of my patients who was an alternate for the Olympics, and he taught me how to swim. And then she came back, the sister from the church, and she said, now prove to yourself you can swim. And I'm like, I don't even know what that means. Or like, I can swim a lap. I mean, am I good? And she's like, no, make a goal, make a big, bold, brave, beautiful goal that you can achieve. And so I put in a raffle for Escape from Alcatraz. It's a raffle because it's an Olympic event. And no one thought I would win. And of course, my name was pulled.
Wow.
And so I had to swim from Alcatraz to the San Francisco Bay shores. And that was how I proved to myself I could swim.
Isn't it just amazing when the women in our lives push us to do things we never think we could do because they see our potential? That's so inspiring. So from doing this incredible feat, what did you learn about yourself?
I learned 2 things that I think I'll never forget, which is fear is passing. As soon as you feel fear, recognize that it is an emotion that will soon pass once you step into it and you push through it. My biggest fear was the hills in San Francisco. I was biking and there was, Olympic athletes on this track. And I saw one of them break the chain on his bike. The hill was so steep that he was sliding down the hill. And my gut, I was afraid. I was like, what happens if that happens to me? And fear is one of those moments where you start making it up and it makes worse and worse. And then you start to think to yourself, just stop that thought process, be present with where you are right now. And the fear itself will slip away and you'll be able to use your brain in a different way, which was, Sherry, just keep pedaling. Sherry, relax your shoulders. Sherry, just breathe. You can make it to the top. And I'll tell you an inspiring thing that got me to the top. There was a Brazilian woman who was in front of me. She's an Olympic athlete. I watched her pedaling out, and she had as a chiropractor, the most beautiful symmetry I've ever seen in anyone. And I'm just watching her pedal. And it was just taking my mind off of the fear and putting it into watching this amazing athlete and how quickly she could transition on her bike to get up the hill. So if you're out there and you're listening and you find yourself in a fearful situation, remind yourself 2 things. It's passing, change your focus.
I just love that. So inspirational. And my last question for today, why is mentorship so important, especially in the type of position that you have and in the chiropractic community?
Well, like you and I being on this podcast right now, and fortunately, their mentorship is an opportunity for both the mentee and the mentor to grow. And we brought together the Adjusted Reality podcast that we did to bring people like a whole new way of looking at things. Is that you may think of it this way, but then have someone like a mentor open your mind to the possibilities. And someone I wish was still alive that I would love to have just sat even for 20 seconds with. Mother Teresa, because she changed the way I looked at things. And one piece of that was do small things with great love. And a mentor sounds like an ominous, awesome responsibility, but really it can be just holding someone's hand for just a moment. It doesn't have to be, 27 years and 5 hours of your day, because that's the big fear when someone says, will you mentor me? Absolutely. Let's talk about where your greatest weaknesses are and then start building around it. And I think that's what mentorship really is. It's a hand up. And I think that the mentor actually gets more out of it than the mentee, because they grow too. And it's such a beautiful relationship of yin and yang and coming together.
I love that. So to finish this conversation off right, where can our listeners find you online? We know you have a podcast. Where else can they find you?
So f4cp.org is our foundation website if you want to learn anything about chiropractic. We also have, if you have never seen a chiropractor or decide, you know what, I'd like to see one. I don't know much about it. You do not have to go to a chiropractor because you're in pain. You can simply get an analysis, and that chiropractor will take care of you and your family. And if something does happen, that you'll have that relationship already built. And it's a strong relationship. The one thing that I often see is comments coming back that, oh, I love my chiropractor. I'll be on an airplane. I'll be sitting there. I'll open up my slides because I'm doing a presentation. And the person next to me will go, are you a chiropractor? And I say, yes. Oh, I love my chiropractor. And they go on for 5 minutes on how great they are. If you're looking to find a chiropractor, you can go to f4cp.org/find a doctor, and that will give you an area to which you live and some options to hopefully find the chiropractor that you will thrive with.
That's terrific. Now, before I forget, did you happen to bring tea with you today?
I certainly did, in my handy dandy cup.
Tell me about your mug.
So this says 50 years, and that's not my age. And that goes on the down low, but it's 50 year celebration, and it's the Alaskan Chiropractic Society, to which I went in October. And it was a monumental event on several reasons. One was it was their celebration of 50 years in existence, but two, they had an extraordinary panel to come together at that event. And the panel was life-changing, and it brought forth reasons. Alaska, unfortunately, suffering with the highest opioid addiction in all of the country, but it brought forth the options that are available and the people that are willing to help, from the firefighters to the police officers to the senators. They were all coming together for the greater good. And so this tea mug is the 50 years at that event. But then they were very kind, and they actually put my name on the back, Dr. Sherry.
That is great. And I love the color
favorite
too. Oh, that is such a great story. And what an amazing trip, and just thing to be a part of, just helping the folks there in Alaska. Well, that's too good. Thank you so much, Dr. McAllister, for joining us today.
My pleasure.
And thanks to you guys too. Check out the Hit Like a Girl podcast website and YouTube page for more great guests like Dr. McAllister today. Cheers.